diabetes can affect the small blood vessels of the eyes, and sometimes you don't even know that those changes are occurring. So it's really important for you to have an eye exam, and so that they can determine the health of your eyes. And especially if your blood sugars have been high, which tends to be the case quite often with diabetes, then that can cause damage to the small blood vessels of the eyes. So it is really important to have that eye exam. Physicians can also play a role in general management of the disease and encouraging people to get their eyes examined by a specialist. It's also important for patients to let the examiner know that they have diabetes.
Well, I like my optometrist just like my general practitioner. I mean, he's just as important to me as my regular doctor is. So I see him once a year for a checkup, because when I discovered I had diabetes, I know I had a sister-in-law who had diabetes and she went blind, so I'm very aware of what diabetes can do to your eyesight.
So the most common type of complication from diabetes specifically would be diabetic retinopathy, and that's when the small blood vessels at the back of the eye become compromised, and that can actually threaten vision. Other things diabetics are more prone to are things like cataracts, which is a clouding of the front of the eye, glaucoma, which would be a nerve condition where the pressure in the eye increases, and different kinds of nerve palsies and things like that. Well, increasingly we see costs of healthcare are managing patients with disease, chronic disease, and the earlier you can detect things, the better it is for the patient, and I think that's quite a rewarding part of what we do, is we can catch those things early, pass the information along to the different disciplines, and we can really improve that patient's lifestyle. So we work with family physicians in a lot of different ways. One common way would be a physician seeing a patient that has some eye symptoms, and they send them here. And of course, the other way would be when a patient comes in here, we check their eyes and we see something that could indicate that there's problems with other parts of the body, or the overall health of the body, then we would refer straight to the physician along with a report to them.
Optometrists have been very nice to me. Whenever I write eye exam for diabetes, I get the letter from them. I get the letter back from them saying this person has diabetes for so many years, he does have diabetic retinopathy, I'm sending him to retina clinic. Or this person has had diabetes for X number of years, his eyes are looking really good, we'll see them in a year again.
Yeah, I didn't think of him as anything else. My GP or my eye doctor, to me, they're both as important as the other.